Complications of C-section. The foremost complication of caesarean section is that problems occur with future spontaneous vaginal deliveries because an operated uterus is a weakened uterus, which may not be able to produce enough or sustained contractions to expel fetus. Maternal complications related to C-section. During surgery, infection might be introduced into the endometrium, pelvis, lungs, or urinary tract. Hemorrhage. During spontaneous vaginal delivery, there are sustained uterine contractions which compress the blood vessels of the uterus, so there is less bleeding. But in C-section, there is no such effect, so there will be more blood loss or hemorrhage. Iatrogenic. Surgical injury to the bowel, bladder, ureter can occur due to instrumentation or manipulation during C-section. After surgery, there can be surgical site pain, impaired wound healing, or infection of the wound. Neuropathy can occur due to injury to the ilioinguinal or iliohypogastric nerve because of instrumentation or manipulation during the surgery. Thromboembolic events may occur due to introduction of blood clots into the bloodstream. If blood clot travels to the blood vessels of the lungs, it can cause pulmonary embolism. If blood clot travels to the vessels of the legs, it can cause DVT. As the patient is bedbound after the C-section, peristaltic movements of the digestive system do not occur sufficiently. It can cause ileus or acute colonic pseudo-obstruction, so the patient is encouraged to move out of the bed. Complications related to the placenta and uterus. Abnormal placental attachment. Placental blood vessels or villi furrow deep into the uterus, but when there is normal uterine tissue, blood vessels of the placenta and villi do not furrow deep into the organs. When there is scar tissue in the uterus, scar tissue is the weakest point of the uterus. So placental vessels or villi furrow deep into the organs, for example, bladder. This condition is called placenta accreta. Uterine rupture. Scar tissue in the uterus is the weakest point of the uterus. When there is previous C-section, there is scar tissue present in the uterus. At this point, uterus can rupture in subsequent vaginal delivery because it is unable to sustain the pressure caused by sustained uterine contractions. Impaired uterine regression. During C-section, enough or sufficient amount of contractile hormones are not produced, so the tone of the uterine muscles is lost, as well as due to instrumentation, uterine muscles get weak. So after the C-section, there is impaired uterine regression due to atony. Fetal complications of C-section, postnatal transient tachypnea of the newborn, acute respiratory distress syndrome. These are the complications of the lungs and they occur after birth by C-section. In spontaneous vaginal delivery, fetus comes out under stressful conditions, so stress hormones that are glucocorticoids produced. Glucocorticoids produce surfactant. Surfactant prevents airways from closing so air can travel freely into the lungs, so the diseases of the lungs do not occur. But in C-section, there are not sufficient quantity of stress hormones that are glucocorticoids produced. Thus, diseases of the lungs such as postnatal transient tachypnea of the newborn or acute respiratory distress syndrome can occur.